going to discuss question paper which has been shared. Okay. So what is a? I hope you are seeing anal canal on the screen. Yes. Okay. So when you see in the pelvic cavity, we have three visceral organs, isn't it? I have been telling you always like three visceral organs are seen from anterior to posterior. So what are the three visceral organs in case of females? We have urinary bladder, uterus, then behind which we have rectum, anal canal. So when you talk about anal canal, it is the terminal part of the alimentary tube. Okay, it starts from, see, this is whole thing is rectum and this is anal canal. So this is anorectal junction and it is ending 3 to 4 centimeters behind and below the tip of the coccyx. See, this is sacrum bone and this is coccyx bone. If you just measure from here, it is 3 to 4 centimeters behind and below the tip of coccyx. The size of anal canal is 3.8 centimeters. That means this much only from here till here. Okay, then. So now if you just see the relations, so like see here, this is the anal canal and we have studied this point as perineal body. 10 muscles meeting point which acts as a support of uterus is perineal body, isn't it? So anteriorly you are seeing anal canal is related to perineal body. Okay, in the other picture if you see on either side, you will see this is the rectum you are finding and this last 4 centimeter passage is anal canal. On either side of anal canal, we will see there is a lot of fat which is actually called as ischiorectal fossa or ischioanal fossa, which will be allowing the anal orifice to expand freely in order to allow the passage of fecal matter during defecation. So on each side, this fat filled area on either side of anal canal is ischiorectal fossa. In the front, we are finding perineal body. In case of males, you also see bulb of penis, and in case of females, posterior vaginal wall. Okay. Then behind, that means when you see from behind, there is a connection, like suppose this is anal canal and this is coccyx. So there is a connection between the coccyx bone and the anus. You call it as anococcygeal raphe. Okay, anococcygeal raphe. Now when you just look into this 3.8 centimeter structure inside, it is divided into three parts better. So it has upper part, intermediate area and lower part. Okay, so upper part is measuring 1.5, 1.5, 15 millimeters is nothing but 1.5 centimeters. Here also it is 1.5 centimeters or whatever you want to take the like units. So upper area is 15 millimeters, intermediate area is 15 millimeters and lower area is true skin which is 8 mm. Okay, now so the upper part will have true mucosa and it will show certain mucosal folds which we will see now. The intermediate area is actually having stratified squamous epithelium and the last area is true skin where we will have hair, sebaceous glands and sweat glands. This area is always maintained in oily and moist condition because of these glands. Okay, then now we are talking about this upper area which is measuring around 15 mm. Okay, upper part of the anal canal. This one from here till here. As you can see here, it has certain folds which are anal valves, anal columns, and you will have, see, this is, see, anal columns are there, anal valves are there, and this area, this upper 15 millimeter area, that is the upper part of the anal canal. It shows anal columns which are actually permanent mucosal folds which are present longitudinally. So whatever mucosal folds you are finding U, these are all anal columns. Okay, in between you will have the anal papillae. Openings are actually sinuses, and if you see the histology part of this, we will have anal glands. Okay, then so these are anal valves, anal columns. Okay, so you can see this is column is the space between the folds. Okay, so you are finding these openings are actually valves. Here you are finding the sinus. Okay, so this is upper 15 mm area. So now let us see the anal columns. All anal columns are also called as columns of Morgagni. These are permanent longitudinal mucosal folds which are 6 to 8 in number. Okay, these mucosal folds. Okay, when you just like strip out this mucosa, just below the mucosa, you will have the veins. The name of this vein is superior rectal vein. Okay, the tributaries of superior rectal vein are seen in the anal columns, which are nothing but permanent mucosal folds which are seen in upper 15 millimeters of anal canal. Okay. So these are anal columns which are nothing but permanent mucosal folds. Okay. Then see, this is Vishram Singh's picture. Whichever book is easy for you, you can follow that. Okay. So these are anal columns which are permanent mucosal folds. You like. Here you have openings which are anal sinuses. Okay. So lower down you are finding this area is anal valve. Okay, we will come back to that picture if required. So now anal columns are permanent folds which we have finished. After that you are finding there is a continuous line formed because of these mucosal folds. So these are crescentic folds of mucous membrane which are actually connecting the lower ends of the anal columns. Lower ends of the anal columns like a wavy line. Lower ends of the anal columns are forming anal valve, a wave like line, that is the anal valve. Okay, that is. So the free margins of these valves are directed upwards. The position of these valves is indicated by a wavy pectinate line, also called as a dentate line. So whatever line you are finding here, which is wavy line, which is formed by anal valves, you call it as pectinate line or the dentate line. Okay, then so this is all anal valves which are directed towards the middle one third of the anal canal. Okay, so now, next, I told you after anal columns, columns are mucosal glands, line is anal valve, dentate line, isn't it? After that, you have openings which are actually called as anal sinuses. So these are vertical recesses. Recesses means openings between the anal columns. Between the anal glands, we have these openings. Obviously, why do we have the openings? To pour the secretions. Now we know like anal columns are made up of glands, isn't it? Those are anal glands, tubular glands. Okay, so they are present in submucosa and they are opening here in the anal sinuses. Okay, anal sinuses are nothing but the openings for the passage of the secretions coming from anal glands. Okay, so like that. So to summarize, we have seen first of all anal columns which are 10 to 15 mucosal glands. Continuous line which is formed is anal valve, okay, which is forming a dentate line or pectinate line. Okay, anal sinuses are nothing but openings of these mucosal glands. Okay, so that was the description what you have here. Now next we have intermediate area, which is also called as pecten, intermediate area. Another name is pecten. So you know it is the upper, this wavy line is pectinate line, we know, isn't it? So inferiorly there is one more line which is called as Hilton's line. So extending between this dentate or pectinate line and Hilton's line, whatever 15 intervening area is there, that is called as pecten. It is lined by non-keratinized stratified squamous epithelium. That means cells are in multiple rows and you do not have a dead layer keratin here. Okay, the mucous lining in this region appears bluish because underlying venous plexus. Like if you see in the previous picture also, here venous plexus is seen. Same similar venous plexus is seen in the middle one third also. Okay, because of that presence of venous plexus, this middle one third area looks bluish. Okay, then so between the pectinate line and white line of Hilton, 15 area is pecten. Okay, which is lined by stratified squamous non-keratinized epithelium. Now, lower area of anal canal is measuring around 8 mm. Okay, it extends and line. It is containing true skin. It has sweat gland. It has sebaceous gland. It shows pigmentation. In adult males, you will see hair is also present in this region. around the anal opening, anal orifice. Okay. Okay, now see here, you can see this is the last 8 part below the white line of Hilton. This is true skin area, okay, where we have hair also, sebaceous and sweat glands. Now, pectinate line, I said this line which is formed by the union of these anal columns is the pectinate line. So it is actually forming mucocutaneous junction. That means actually this whole area is something like skin, and the upper 15 is we have the mucus lining. So here it is actually forming a junction of mucocutaneous junction. So the, like when we study embryology, we will come to know above pectinate line the area is developed from endoderm, and below pectinate line the area is developed from ectoderm. So above this line is endodermal origin, below this line is ectodermal in origin. Okay. Then this is the line of demarcation which is shown in red arrow. Then blood supply, like upper part is supplied by superior rectal artery and lower part is supplied by inferior rectal artery. Okay. Then so venous drainage, above pectinate line we have superior rectal vein and lower part is drained by inferior rectal vein. Okay, the lymphatic drainage also, upper part is draining into internal lymphatic, internal iliac group of lymph nodes, and lower part below this pectinate line it is draining into inguinal group of lymph nodes. Okay, and this line is actually called as watershed line. Upper is going to iliac, lower is going to inguinal. Then nerve supply. So upper part is pain insensitive. This is very very important. We have piles as like clinical question. Okay, piles are nothing but hemorrhoids where you will see in the fecal matter there will be bleeding and lot of blood is seen. That condition is piles. So we have external piles and internal piles. So if the veins in the upper 15 millimeter area are ruptured, the piles will be painless. Why they are painless? Because upper 15 millimeter area is basically pain insensitive because it is supplied by superior hypogastric plexus. Okay, whereas below pectinate line where we have this mucocutaneous junction like stratified squamous non-keratinized epithelium and true skin, this area is supplied by somatic nerves. The upper part is supplied by the autonomous nerves which is pain insensitive, whereas the lower part 15 plus 8 it is supplied by like somatic spinal nerves which are pain sensitive. Internal piles are painless because here it is supplied by superior hypogastric plexus. External piles are highly painful because they are supplied by somatic spinal nerves. Okay, so anorectal diseases usually start at pectinate line. Okay, anorectal, that means what? The diseases which is related to rectum and anus. Okay, so this is Hilton's line. So this color contrast line, when you look into the cadaver or in the real body, when you are doing some surgery, you will see this line looks bluish pink area above and black skin below. Okay, so it shows importance of this white line of Hilton. It is the lower end of internal sphincter muscle. Here you will see anal fascia and lunate fascia are only stopping here, extending till here. That means the fascia which is present in anal canal is ending here. Internal anal sphincter muscle is also ending here. Okay, so that is white line of Hilton. So once you know the interior, upper one third, middle one third, and lower part, now after that, we will go with another thing, that is sphincter muscles. Rectum's continuation is anal canal. Now this is the musculature of anal sphincter. So we have internal anal sphincter which is shown in violet color. External anal sphincter is shown in red color. So this internal anal sphincter, it is thickened involuntary circular muscle layer of anal canal. Now if you generally see the GIT histology, we have mucosa, submucosa, muscle layer and serosa. So in the muscle layer, we have inner circular and outer longitudinal from your histology knowledge. So inner, like internal anal sphincter is thickened in involuntary circular muscle layer of anal canal, and it is surrounding the upper three-fourth of the anal canal, extending from the rectum anorectal junction to the white line of Hilton. From the anorectal junction to white line of Hilton, this smooth muscle is extending. Okay. Then this internal anal sphincter, it is supplied by superior hypogastric plexus, okay, sympathetic, and pelvic splanchnic nerves, parasympathetic. Okay, this is only to memorize. There is nothing to like logically explain here. Now coming to this sphincter, which is outside, that is external anal sphincter. This is striated voluntary. When we are ready for defecation, then only you will see the sphincter will relax and it will allow the fecal matter to pass out, unless we are suffering with severe uncontrolled diarrhea. Otherwise, it is completely under our control, and it is skeletal muscle, not smooth muscle. The internal sphincter was a smooth muscle, whereas this is a skeletal muscle. See the difference. Okay, then inner circular muscle was modified for that, but here you will see this is striated skeletal muscle surrounds the whole length of anal canal. Okay, whole 3.8 centimeters of anal canal is surrounded by this external anal sphincter. Okay, then now, external anal sphincter has three parts. So, what are the three parts we have? We have subcutaneous part, which is below the skin. Then it has superficial part, which is in the middle, and it has a deep part. Okay, subcutaneous, superficial, and deep. So, subcutaneous part is flat and it is surrounding the anus just under the perianal skin. Just below the skin, we will find this muscle, that is the subcutaneous part. Okay, it is attached to perineal body and anococcygeal raphe. Rest of these two muscles, you just name them, you need not give the details. Okay, so we have subcutaneous part, we have superficial part and deep part. Okay, so here also we are shown. See, we have subcutaneous part is just below the skin. This is Vishram Singh's picture. Then we have superficial part and then we have deep part. So these are the three components of external anal sphincter, which is a voluntary muscle. Okay. Now see, this is the pectinate line beta. Above that you are finding anal walls, anal columns. This is upper one third. This is middle 15 mm. This is the lower true skin. Okay, different pictures are showing the same thing. Okay, so these are the like external anal sphincter muscles, superficial, subcutaneous, superficial, and the deep part. Okay, so rectum is different story. Now we are doing. See hemorrhoids. What are hemorrhoids? See, question also may be framed in this way only. Specialized highly vascular cushions. That means we have seen superior rectal vein, inferior rectal vein. They are forming a venous network in the anal canal. So whenever blood pressure rises, like in case of portal hypertension, okay, so what happens when high blood pressure is there, these veins may rupture and it may lead to bleeding per annum. Okay, so hemorrhoids are highly vascular network consisting of discrete masses. Where do we see this venous network? In the submucosa, that is containing blood vessels. Okay, so hemorrhoids you are finding, see here, these are the venous network, and you are finding, so because of this high blood pressure or portal hypertension, they may start to bleed like this. Okay, so external piles and internal piles. Internal piles, I said, they are painless, and external piles which are below pectinate line, they are highly painful. Okay, and based on the area, like which venous network is damaged. Okay, so the venous network, if it is damaged at 7 o'clock, we may have these three different positions for these piles: 7 o'clock, 11 o'clock, and 3 o'clock position. Okay, so internal hemorrhoids, you are finding, just I said you, below the pectinate line, whatever is there is external hemorrhoids. Okay, pectinate line is also called as dentate lines. Okay, blood is draining through the like internal inferior rectal veins to pudendal veins, and also into the internal iliac veins. So you will see all these veins are dilated in case of external hemorrhoids. Only difference you see here is actually external hemorrhoids are painful and internal hemorrhoids are painless. And external hemorrhoids area, you have inferior rectal vein. Internal hemorrhoids above pectinate line, I said we have superior rectal vein dilatation. So these two major differences you try to understand. Okay. All these are venous networks, and you will see this is external. Piles hemorrhoids are nothing but synonyms only. Okay. So above pectinate line, we have superior rectal vein. Below pectinate line, we have inferior rectal vein. So they may get dilated and they may get ruptured if there is any like hypertension due to any reason. Okay. So hemorrhoid symptoms, patient usually will have chronic constipation. The fecal matter becomes very much hard. Okay, and it is very difficult to pass the stool sign. Because of that, we know in the submucosa only we have venous network. So that venous network is getting lot of pressure due to stony fecal matter. Hence, those blood vessels will rupture. Okay, so pain will be there, which is very sharp, knife like itching may be there, burning may be there, bleeding may be there. These are the symptoms of hemorrhoids. Okay, so all these are not required, but you can see how painful this is, like your. So usually in case of hemorrhoids, topical agents means local ointments are given. Okay, so basically we should ask the person not to take much junk foods, and we have to ask the person to take food rich in fiber, which is generally preventing the condition of hemorrhoids. Okay, so this is rectum different. Anyhow, rectum we are not doing now, isn't it? Okay. What is the next question? Bronchopulmonary segments. So till I do this, you just see here. Now, first of all, what are these bronchopulmonary segments? Let me tell you. So the tracheobronchial tree, I'll take you from the tree so that you understand. See, we have nose. From the nose, the air starts moving into trachea. From the trachea, it moves into the right lung through right principal bronchus, left lung through left principal bronchus. So each principal bronchus will now divide into right. Principal bronchus can be also called as primary bronchus. So from primary bronchus, we have secondary bronchus to tertiary bronchus, then tertiary bronchus to we have bronchioles, and then we have alveoli. Okay, I'll show you one picture. See, trachea, bronchus, primary bronchus, secondary bronchus, tertiary bronchus, then we have finally you will have alveoli. So bronchopulmonary segment is nothing but a particular part of the lung segment which is actually aerated by a particular bronchus. See here, I'll take you, you will understand the definition. Well-defined wedge-shaped sector of a lung which are aerated by tertiary bronchus. Tertiary bronchus, whatever part of the lung which is being aerated by tertiary bronchus, which is actually called as bronchopulmonary segment. Okay, so bronchopulmonary segments are well defined anatomical, functional, and surgical units of lung. So see here, we are just looking at this right and left lung. Right lung only seen from two different views. So if you observe, right lung will have 10 bronchopulmonary segments. Left lung also will have 10 bronchopulmonary segments. What does it mean? That means tertiary bronchus is going and aerating each of these segments. These are anatomically separate segments, as though you have 10 rooms with different like walls are separating these rooms. So suppose if there is infection occurring in the apical segment, it will not move to the posterior segment, it will not move to the anterior segment. You can just remove only apical segment if there is any infection, pneumonia, cancer or something. That means these are segments which are confining both the aeration and also spread of infection. So that is the advantage of bronchopulmonary segments. Okay, so these are well defined wedge shaped, irregular shaped sectors of lung which are aerated by tertiary bronchus. So bronchopulmonary segments are well defined anatomical, functional and surgical units of lungs. Surgical in the sense if they get damaged, we will remove only that particular part of the lung. So now see here, just if you look at this, this is, we are shown three segments here, one, two, three. Each segment, see this is our tertiary bronchus. So from the tertiary bronchus, we will have bronchiole, then we will have alveoli, isn't it? So this is the branching pattern of the tertiary bronchus. Now it is on either side. Each bronchopulmonary segment will have its own artery and vein. So we have bronchial artery, and then we also have the pulmonary artery over here. Correspondingly, veins also will be there. We know pulmonary artery is the only artery which carries deoxygenated blood. Bronchial artery supplies the lungs. So on either side of tertiary bronchiole, you are supposed to draw one pulmonary artery and one bronchial artery. Okay, this is one segment, two second segment, third segment. Like that, how many segments do we have? 10 segments in each lung. So in between the lobes, you have intersegmental planes. So these are intersegmental planes along which you will have pulmonary vein. We know pulmonary vein is the vein which is carrying oxygenated blood. So you draw this well labeled diagram. It looks like a pyramid. Base is this and apex is pointing towards hilum of the lung. Apex is pointing towards hilum of the lung. So this is base, this is apex. So in each of the bronchus, we have tertiary bronchiole, okay, the branch of pulmonary artery, bronchial artery. And in between interstitial planes, we have pulmonary vein tributaries. You call it as pulmonary venule. So the same thing is written in the form of theory. So characteristic features of these bronchopulmonary segments. So they are the subdivisions in the lobe of lung. That means right lung will have 3 lobes, left lung will have 2 lobes, isn't it? So within those lobes, we have further bronchopulmonary segments. They are pyramidal in shape. Apex is directed towards hilum and base is towards the surface of lung. So it is surrounded by connective tissue. In each bronchopulmonary segment, you will see there is one own artery, isn't it? We saw bronchial artery, we saw pulmonary artery. In between, we saw the pulmonary venule. So obviously each segment will have its own lymphatic drainage also. Then autonomic supply. So autonomic supply, that means it has like sympathetic and parasympathetic nervous innervation also. In between the lobes, like bronchopulmonary segments, I told you we have segmental veins. So segmental veins are nothing but tributaries of pulmonary veins. These are segmental veins. Okay, so you can draw this diagram and put your like own words explanation. So like wise we have see here. So this is right lung, we have see this is upper lobe, this is middle lobe, and this is lower lobe. Right lung has 3 lobes, isn't it? So in the upper lobe we have apical segment, we have anterior segment, we have posterior segment. In the middle lobe, we have medial segment, lateral segment. And in the lower lobe, we have superior segment, then anterior basal, lateral basal, then we have posterior basal. Okay, like that we have 10 bronchopulmonary segments in each lung. When you come to the left lung, it has only 2 lobes, like it has upper lobe and lower lobe. So in the upper lobe, we are finding apico-posterior, then anterior and superior lingular, inferior lingular segments. Then we have superior segment, then anterior basal, lateral basal, and posterior basal. See, bronchopulmonary segments picture is very beautifully given in Chaurasia, and table is also given very well. For this particular answer, I recommend Chaurasia book beta. If you do not have hard copy, you can just download the soft copy from the link what I have shared in our group. Okay, so these are the bronchopulmonary segments of right lung, and they have been named here. Okay, all 10 segments. See, apical, then posterior and anterior segment, and so on. Similarly, we have 10 segments for left lung also. Okay, so like that. So this is the tracheobronchial tree. So we have trachea, we have bronchus, right pulmonary bronchus, left pulmonary bronchus. From the primary bronchus, we have secondary bronchus. From secondary bronchus, we have tertiary bronchi. So tertiary bronchi only is aerating. See, this is the tertiary bronchus, which is going to the upper lobe, it is going to the middle lobe, it is going to the lower lobe. Total, if you see, we will have 10 segments on right lung. Total, if you check, in the upper and lower lobe, in the left lung, we have total, we have 10 bronchopulmonary segments. Okay, so knowledge of these segments is actually important. As I told you, see, if there is any infection here, you can just do the resection of that particular segment. So that's what is called as segmental resection of lung. Okay, so that is all about bronchopulmonary segments. Try to practice the diagram till I take you to the next answer. extrahepatic biliary apparatus. What is it made up of? So